Well, my sincere thanks to Ron Duquette, the management team and community advisory circle of Legends Row, and to Dr. Gary Morningstar for my nomination. And to my wonderful wife, Allison, and her 4 children for their love and support, despite my often being away from our home involved in patient care or teaching activities that ultimately led to the recognition that I'm privileged to receive today. And to my parents, Betty and Lou, who guaranteed the bank loan we needed to move to Mississauga, buy the land and build a combination home and medical office. And to the many people who've been privileged to know and work with over the years at Dixie Road Medical Associates, the Mississauga Hospital and the Trillium Health Network, Faculty of Medicine, University of Toronto, College of Family Physicians of Canada, the World Organization of Family Doctors, and as you've heard, Applewood United Church, the Mississauga Golf and Country Club, and also the Applewood Probus Club for the last 15 years. When we moved to Toronto Township, as it was known in 1956, it was a collection of farms, orchards, and villages, Dixie, Cooksville, Port Credit, Streetsville, with a total population of 10,000 people. We bought property on the west side of Dixie Road north of the Queen E.W. from Mel Watson. He was a farmer and father of Bob Watson, who some of you may remember is a longtime lawyer in Port Credit and a good friend. Glenn Grice, who you may also remember, built us a combination home and office, and we moved in on September the 1st, 1956. The practice grew rapidly. In the early 1960s, I started to build a family doctor group. And in 1965, now with 4 children, we moved our home to a new house on Dixie Road South. In 1970, utilizing the adjacent property that we'd purchased, the office was enlarged and still in the same location, now with 9 family physicians. With partners to cover my practice, I was able to accept an invitation from the Dean of Medicine at the University of Toronto to teach part-time. Interestingly, the students always appreciated that I was still actively practicing medicine because to them it made my clinical teaching more relevant. It also meant that some medical students received training in Mississauga. And this has now evolved to the point where, would you believe this, that some University of Toronto students take their entire undergraduate program at the U of T's Mississauga campus. Allison and I have loved living in Mississauga. The schools for our children were excellent. We've both been very active with Applewood United Church. My retirement years were greatly enriched recently by being a member of a church committee that brought 3 Syrian refugee families to Canada, and they're all doing extremely well. So today, for me, it says it all. Thank you.